The Biden administration recently announced funding of over $1 billion that states can apply for to help fight the ongoing opioid crisis. Our team spoke with the director of National Drug Control Policy at the White House. And 7 News reporter Jake McGlumphy shares how this funding could help save thousands of lives.
President Joe Biden and his administration have announced the 2024 State and Tribal Opioid Response Notices of Funding Opportunity. The funding would provide up to $1.48 billion to states and territories throughout the country to address the overdose crisis in 2024. The state of Ohio is eligible to apply for more than $100 million of that funding. The director of National Drug Control Policy at the White House, Dr. Rahul Gupta, shares exactly what the funding would help with.
Part of that includes making sure that communities and families in West Virginia and Ohio and Pennsylvania have the access to resources. So when somebody's overdosing, they have access to naloxone or Narcan. When they need to get treatment, they're coming to the emergency room, they have that ability to get people started as opposed to waiting 2 months for an appointment.
According to Dr. Gupta, the initiative is meant to provide as many resources as possible to prevent opioid overdose everywhere. But he says there is one demographic that needs it more now than ever.
One important piece of this is making sure that people who are incarcerated get the help. Oftentimes, we have way too many folks who are, first of all, in jails and prisons because of drug use problem, but then when they re-enter society, they either overdose or they are reincarcerated.
Although the opioid crisis continues to be deadly in many parts of the country, Dr. Gupta says they are moving in the right direction to reduce the number of overdoses in the U.S.
We are flattening the curve. What that means is while there are way too many people still dying, we are making significant progress, and these funds will go to save even more lives. Ultimately, we need people who are recovered, and they're in recovery, and they're helping their communities get to the next level.
Dr. Gupta says states will have to apply for the funding through state and local municipalities. He says his hope for the future is that states will work with the federal government with a sense of urgency to provide treatment and resources for everyone in need. Reporting for 7 News, I'm Jake McGlumphy, working for you.